Hi, Ms. Hughes. I'm Dr. Bailey. Nice to meet you. So, I've really just come, obviously the first time we've met, I've just come to discuss really about what's been happening since you've been admitted to hospital. I've clearly read your notes and I've brought myself up to speed, but would you like to just go through sort of what's been happening and how much you know?
Well, I mean, most of what I know happened before I came in hospital, really. I started getting very stiff hands in the morning when I woke up.
Mm-hmm.
And other joints were stiff as well, but my hands particularly. And the GP had been treating me with ibuprofen, which did help the pain. And then suddenly it went worse, and my hands didn't just hurt, they were swelling, and my knees started swelling as well.
Right.
So he sent me for some tests and told me that I've got something called SLE.
Yes, yeah, that's right.
Which was a bit of a shock. And I guess I'd been preparing myself for rheumatoid arthritis, which my mum has.
Right, so you got some knowledge of that.
But I think this is probably much worse. And I'd also started getting a rash on my face.
What makes you think it's worse than, say, rheumatoid arthritis? Which
I don't know, really. I think I only know sort of vaguely one person with this. And she seems to be deteriorating much more quickly than my mother.
Right.
And they're about the same age, so...
And you said you vaguely know them. Do you...
I don't know them well. It's a friend of my mother's, really. And, and when he said that, I just thought of her. Thought, oh gosh, she's...
Yeah.
It's much worse than rheumatoid arthritis. And the other thing is, since I've come in hospital, they say there's something with my kidneys.
Yes, that's right. We have found some, which we'll go into definitely and try and explain.
It's not very good news.
Well, I mean, I think...
And I really don't know anything about SLE except it's not good news.
I mean, it's certainly... I think in a way, at least we know what it is, and at least we can, confront it and we can deal with it. So I certainly agree, SLE, or that stands for systemic lupus erythematosus, is the sort of big...
I can say that.
Yeah, well, I can't on most days. But it's a condition similar to rheumatoid arthritis, or that type of condition, which is like what they say like an inflammatory condition. So you can get inflammation. The fact that it's the systemic, means it can affect different areas, and you've mentioned your kidneys, which we'll certainly go into, and clearly it's affecting your joints as well, and you mentioned the rash, so it can affect different areas, and that's really why they say systemic. The fact that certainly the blood tests show that your kidneys are not working as well as they should, it is a little bit of a worry, and that's certainly something that we need to look into. And I think when we took a sample of your urine off, there was a little bit of blood and a little bit of what we call protein in there. So it sounds like your kidneys are just a little bit leaky, so they're just letting those some protein out and a little bit of blood out. Now that can be due to the lupus or the SLE, and we need to look into that. And there are treatments for this, so you're gonna we can certainly make you better and make your joints better, but it's certainly something that we do need to take seriously, and we do need to do further investigations for. The fact that you've been taking the ibuprofen isn't the wrong thing. Your GP, people commonly take those type of tablets, and they're in a group of tablets called non-steroidal anti-inflammatories, or NSAIDs. Now those themselves can have an effect on your kidney. They're very common drugs, you can get them over the counter. Most people take them with no problems at all. So the fact that we now know your kidneys aren't working as well as they should, and we hopefully stop those, so you're not taking those anymore, there might be some recovery of your kidneys just by stopping those. I suppose the question is, how much is it due to the SLE, or how much is it due to taking those types of drugs? And we'll find that over the the next few days and weeks.
How bad are my kidneys?
What
did the results show?
Yeah, okay. So they showed that there's something called creatinine, which is something that's cleared by your kidneys, and that was a little bit raised. It's nothing like in the range where you would need dialysis or anything like that.
Yeah, that's what I was reading.
Yeah, no. So it's nowhere near there, and I'm sure with the treatment that we give you, that's not going to be an issue. In the foreseeable future. But certainly we need to take it seriously. We need to find out if it is due to the lupus, and if it is due to the lupus, then there are treatments we can give to try and make your renal function hopefully not get any worse, and hopefully in the best scenario make it better. So because of the kidneys are affected, we know that your blood tests, there's some things within your blood which have suggested very strongly that the condition that you have is SLE. The next step we need to do is a biopsy of your kidneys, and that will give us a lot more information about how mildly or not your kidneys are affected. So that's one of the next steps we need to do is a kidney
has
biopsy.
Already mentioned that.
Good.
The thought absolutely terrifies me. I'm
Right.
not good with needles, and it's a great big needle in the biopsy, isn't it?
Well, it's a long needle, not necessarily a big needle. And usually it's not the length of a needle which is the problem, it's how big the needle is. So the needle's very small, although it is long because it needs to get into your kidney. Now, it's something that we do all the time here, so we're very used to doing it. It's a very safe procedure, and also we use lots of anaesthetic as well.
What if you hit the wrong thing?
Well, there's always a risk with any medical procedure that something goes wrong, and certainly bleeding is a risk. Infection is a smaller risk, but we take precautions not to hit the wrong bit, to hit the correct bit, and we also monitor you afterwards extremely closely. So if we did hit the wrong bit by mistake, which does happen, but only in a very, very small percentage, then we deal with it very quickly, and we monitor you extremely closely afterwards. So certainly there'd be lots of pain relief beforehand, and lots of anaesthetic, and pain relief afterwards. So hopefully it's something that we do, pretty routinely, and it doesn't take long to do. So I'd certainly reassure you that it's a pretty safe procedure, and the pain, that the thought of the pain beforehand is usually a lot worse than what people describe after they've had it done. So it's usually the fear of the unknown, if you like. So I'm sure we'll.
I don't really understand how you hit the right thing.
Well, mainly, we use ultrasound.
Oh.
Yeah, so the ultrasound will show us exactly where we need to go, and then with the ultrasound on you. So it's a slightly different, unusual procedure in the fact that you lie on the couch on your front, and we basically go in from the back, and we use the ultrasound to find your kidney. We numb everything, clean everything, numb everything, and then once we've found your kidney exactly where we want to go with the ultrasound, then we pop the needle through the numb bit and then just directly into the kidney, find the correct bit, and take a little tiny sample. So it's that's it. So it is a very, very straightforward procedure. So it's don't be worried about it.
And what's that going to tell you?
So it will. I don't think there's any doubt that you do have SLE. It will tell us, are the kidneys affected? Because what we do need to know is which bits of your body, if you like, are affected with the SLE. And if we take a kidney biopsy and we look at the kidney, then that will tell us how much or not that the SLE is affecting you, and that will help us decide what type of treatment we'll give you. So it'll give us lots of information about how we can help you with treatment. Does that make sense?
Yes.
Yep.
I'm just wondering, though, you've said about the ibuprofen.
Mm-hmm.
what sort of treatment will the hospital give me
Yeah.
for SLE?
I mean, there are lots of treatments available, and we need to get the right one for you. As the SHO, I can give you a sort of a brief outline, but that decision will be made by the consultant and after discussion in a meeting really to get the best treatment. So where you've got where I mentioned the non-steroidal anti-inflammatories, the steroid bit is what you need. So it might be the fact that we will give you some steroid tablets rather than the non-steroidal. So it might be that you need steroids. It might be also that you possibly need something called immunosuppressive therapy. So that's the steroids will do a similar job as well, but the immunosuppressive therapy, what they do is, because SLE is an inflammatory condition, and we're not sure what causes it, but it's a scenario where you it's called an autoimmune. So that means that your immune system, which usually fights infection, sort of turns around and actually starts damaging yourself. So starts damaging your joints, starts damaging your kidneys. So what we need to do is try and turn off that process or dampen it down. And steroids do that very nicely and very quickly. But there are but there are side effects to the steroids in the long term. So ideally, you don't want to be on them for a long time and at a high dose. So there are other tablets which will dampen down that immune system and hopefully therefore stop your body causing that type of inflammation. So damping down the inflammation within your body, which will hopefully help your symptoms and hopefully improve or certainly not worsen your kidneys.
These whatever they were called,
immunosuppressants.
Do they have the same? Do they have bad side effects?
I mean, they have different side effects because your immune system fights infection. One of the main side effects from it is the fact that you can get infections because your immune system's there for a reason. In yourself, it's gone slightly wrong, and we do need to damp it down. If we damp it down too much, then you're at risk of getting other infections. And occasionally, we will give you other tablets to try and prevent those infections from happening, and monitor you very closely and try and get the dose exactly right for you to get the inflammation under control, but not damp down your immune system too much that puts you at risk of infections. So it's something that we do all the time, and we monitor extremely closely, and we'll hopefully get exactly the right level for you that's needed to control the lupus, but prevent, hopefully, you getting infections.
Right, thank you.
Have you, I mean, obviously we've discussed a lot, have you any other sort of specific concerns or anything that you do want clarified?
No, I mean, I would like to be the other side of having had the biopsy, because that does scare me, but I guess we have to wait and see what that shows.
And
then sort of ask further questions.
Yeah, and we're certainly going to do that very quickly and move on to the discussion about the treatments very soon.
Yeah.
Excellent.
So there's clearly a lot of different areas that you covered in that scenario. Would you like to summarise the main points for me, please?
I suppose the main points are this is a new diagnosis for this lady, and it's got implications onto how we're going to investigate her now, and also on treatments. So this is delivery of a major diagnosis really, and how we're going to manage that diagnosis. So the main points really, I suppose, are trying to explain to her the diagnosis and trying to reassure her really, because clearly there's quite a lot of information. She has some background knowledge of autoimmune conditions such as rheumatoid and a little bit about SLE from a distance, and trying to be positive, I suppose, about treatments.
Okay, so you spoke to her already about some of the potential complications or side effects of immunosuppressant therapy, not just the steroids, but also with other treatments, and a lot of that was focused on infection. Do you think of any other important areas that you'd need to discuss with her, before?
Yes, I think, so infection's probably the biggest and the major risk. There are others, such as malignancy, which I suppose at this type of stage probably wasn't the ideal place to raise it, but certainly I think malignancy at some point before she goes on to that type of treatment should be raised. So infection, malignancy, they're the two main areas.
Okay.
Yeah.
And so in someone who's fairly young like this, obviously not all of the drugs, but some of the drugs you may use might have.
Yes. So definitely. That's another area. Definitely is whether this young lady would want to get pregnant, and would it be teratogenic, and that might influence which immunosuppressive treatment that is chosen, and even you might even go even further to talk about harvesting eggs or things like that if potentially she would become infertile by some of the treatments. So those are big issues that would need to be thought about and addressed prior to starting this type of treatment.
Okay, so you clearly gave her a lot of information. In addition to talking to her like you did, would you direct her anywhere else for more information? Or
yes, there will be leaflets on SLE, so we could certainly give her leaflets from the various societies, and we could also we'll hopefully have a specialist nurse who could give us some information, and also probably official websites. I think if there was an SLE association, which hopefully should come on the leaflet, so there should be lots more information rather than just my interaction that she can access afterwards.
okay.
Yeah.
Okay. Thank you very much.